ma'am. Good morning. It's nice to see you again.
Good morning po.
So, for today's meeting, we'll be discussing about how to fight against iron deficiency because that's your specific anemia, right?
Yes.
So, our title is From Tired to Wired, Fighting Back Against Iron Deficiency. So, our objectives are to define anemia, classify the different kinds of anemia, identify the symptoms of anemia, identify the causes of anemia, identify the risk factors of anemia, and then also to explain the complication if anemia is left untreated, identify the preventative measures for anemia, understand the diagnosis process of the physician, and finally we have to identify the treatments for anemia. So, first ma'am, in your own words, what is anemia? Do you have any prior knowledge?
Anemia is a blood disorder.
Yeah, it is. Very good. So, anemia is a problem of not having enough healthy red blood cells or hemoglobin to carry oxygen to the body tissues. Hemoglobin is a type of protein found in red blood cells that carries oxygen throughout the body, and if you don't have enough of that, it can cause anemia. And there are two types of anemia. We have inherited and nutritional anemia. So there are approximately 400 different kinds of anemia, and it can range from iron deficiency, blood loss, or damaged red blood cells. With this, it can either be nutritional or inherited. But we won't be identifying all 400 of them. We'll be limiting the examples to 8, the most common so far. So inherited anemia is caused by a gene mutation. You know a lot about gene mutation. Know that you're a dentistry student, so can be passed on to your children if you do have this. So our first example is sickle cell anemia. Sickle cell anemia is when they alter the shape of the red blood cell. So yes, it's like an irregular thing. And then we have Fanconi anemia, a genetic disorder that affects parts of your body like the bone marrow. So your bone marrow produces most of the red blood cells, right? So in this case, Fanconi anemia affects your bone marrow. So it can end up with not very healthy red blood cells. Next are Diamond-Blackfan anemia. This one, beforehand we have the Fanconi, which it affects the bone marrow. Am I correct? Diamond-Blackfan also affects the bone marrow. It limits the bone marrow's ability to make enough red blood cells. Next is thalassemia. In this case, the body doesn't produce enough hemoglobin to distribute oxygen throughout the body. So we have 4 so far. So we have 4. We have sickle cell, Fanconi, Diamond-Blackfan, and thalassemia. Next we have the nutritional anemia. It's when you don't get enough vitamins and minerals into the body because of your diet. First one is iron deficiency anemia. There's insufficient iron for the hemoglobin production due to poor diet. Then we have vitamin B12 anemia, which is inadequate vitamin B12, and it can cause low red blood cell counts and can cause neurologic symptoms. Next we have megaloblastic anemia. It's triggered when you don't have enough vitamin B12 or vitamin B9, and because it makes your red blood cells large. And then we have pernicious anemia. it reduces the absorption of vitamin B12. So your body can absorb vitamin B12 correctly or properly, which makes it that you have megaloblastic anemia. So pernicious anemia kind of enlarges your large blood cells because you don't have enough vitamin. Since our next topic are the possible symptoms. But before that, can we have a little small quiz? I'll be saying if we'll be identifying if it's inherited or nutritional anemia. So you'll write down in your paper if it's I is for inherited anemia, and then N is for nutritional anemia. So number 1, sickle cell. Number 2, iron deficiency anemia. Okay. Number 3, Fanconi anemia. Number 4, thalassemia anemia. Thalassemia. And 5, megaloblastic anemia. And lastly, pernicious anemia. Okay. So number 1, sickle cell. It is inherited anemia. Number 2 is iron deficiency anemia, which is nutritional anemia. Then Fanconi anemia is inherited. Number 4, thalassemia is inherited. And then megaloblastic and pernicious anemia is nutritional, both nutritional. Yay, perfect, very good. So I have this brochure. You can have that now. So our next topic is about possible symptoms of anemia. This can include tiredness, weakness, shortness of breath, pale or yellowish skin, which might be more obvious on white skin than on black or brown skin, then irregular heartbeat, dizziness or lightheadedness, chest pain, cold hands and feet, and finally headaches. So in the brochure, I have included checklist of the symptoms, and I want you to check out the symptoms that you have experienced. You can also use a brochure in the future if you would like to visit the doctor. So it can be the reference on what you have felt. So what did you check out?
Tiredness, weakness, shortness of breath, pale or yellowish skin, which might be more obvious on white skin than on black or brown skin, irregular heartbeat, dizziness or lightheadedness, cold hands and feet, and headaches.
So most of it. I hope you're doing okay today. Are you okay? Yes. Very good. The next we have our next topic, which is, as you know, anemia usually occurs if there's not enough hemoglobin, but there are also other causes like bleeding causes loss of red blood cell and hemoglobin, and your body can't produce enough of it to replace it. So bleeding is a no-no. Next is the body destroys red blood cells and the hemoglobin that's in them. So sometimes we have disorders in our body where your own body destroys your own body in a way. I forgot the term. There's a term for it. I'm really sorry. I dropped that one. Yes, thank you. Oh yeah, before we go on to this, we'll have a short true or false quiz. You can write it down. Alright. Do you want to write it down or do you want to verbalize? So anemia is when the body makes too much hemoglobin or red blood cells. Is this true or false?
False.
Then next question. Bleeding causes loss of red blood cells and hemoglobin fast that they can't really produce into And then lastly, your own body destroys red blood cells and hemoglobin in such cases. Our next topic is mild anemia. This is also in your brochure in the middle. So mild anemia can cause serious problems, but if you leave it untreated, the following can occur. For example, heart problems. It can cause rapid or irregular heartbeat. This can put stress on the heart because there's not enough red blood cell and the heart has to work twice as much as to make up for the lack of oxygen in the blood. And then next. For pregnancy complication, if a mother is pregnant, she has to feed not only herself but also the baby, right? So during pregnancy, your blood volume increases. And if you have insufficient supply in the first place, you can develop iron deficiency anemia. Next is developmental delays. This can occur to little kids, like children. And for this example, like premature babies with a low birth rate are at risk because they store too little iron in their body. And this can affect their developmental stage like late walking and talking, and can also manifest in their behavioral problems. And then lastly, we have impaired immune system. So your iron actually helps your immune system to fight off diseases like flus or colds. And your immune system has a cell called T cell. Now your T cell needs a lot of iron to function properly. But if you don't have enough iron, then your T cell can't do its job properly. So you're doing okay now? Are you learning? So again, before we proceed on how to prevent anemia, we will have a small quiz. This time it will be easy. It's a matching type of quiz. If it's alright, can I send you the file for the quiz? Okay, I've sent you the file. You can use your pencil for this one. So it's a matching. I'm so sorry. Bakit hindi? That's good. Okay. Good. is all correct. Congratulations. We will now proceed to our next lesson. So, how to prevent nutritional anemia. So I didn't put here the inherited anemia because you can't, in most cases you can't prevent it because it's passed on. But for nutritional anemia, it's based on your diet, so you can most likely prevent anemia. So the first thing you can do is by eating iron-rich foods like red meat, green leafy vegetables, peas and beans. And then second is you can consume fruits and vegetables with folate and vitamin C for better absorption of iron. Some examples are melons, oranges, tangerines, and tomatoes. So, a quick review. What are the iron-rich foods? Can you give me two? Beans. Red. Yes, meat. Red meat, yes, correct. And then, how about the vitamin C and folate rich? Tomato, and oranges. Very good. So now we will proceed on what are the process of physicians when they are to diagnose you. So they will be running some tests in order to diagnose you properly. So the first test would be red blood size and color. So red blood cells appear smaller and paler in color than normal if you have anemia. And then for hematocrit, this is to measure the blood volume, where the normal levels are for women are 35.5 to 44.9. For men is 38.3 to 48.6. And the numbers may change according to your body. And if your blood volume is any lower than that, then it can indicate anemia. So we have red blood cell size and color, and then hematocrit. Next are hemoglobin. The normal range for women is 13.2 to 16.6 grams. And for men, it is 11.6 to 15 grams. And any lower can also indicate anemia. So we have red blood cell size and color, hematocrit, hemoglobin. And then lastly, we have ferritin. This kind of protein helps store iron in the body, and low levels can indicate anemia because the body can't store enough iron in the body. And then further tests like endoscopy, colonoscopy, and ultrasound may also be done if ordered by the physician and you can't see any problems with the test before this. Okay, what is the drill? We will have a small quiz again. I hope you are still having fun, ma'am, with learning. So, it will be the same. It's just verbal, true or false again. So, appearance of red blood cell is small and clear in color if the patient has anemia. Hematocrit is the blood volume you have, and it stays within a certain range throughout your whole life. False. Correct. If hemoglobin and ferritin are low, it can indicate anemia. True. Correct. So now we are on to how to properly take iron supplements. So if your physician has diagnosed you with iron deficiency anemia, he can prescribe you medicine like iron supplements. So this is also included in your brochure, so you can come back to it if you need. So number one is taking iron tablets on an empty stomach. So you can take it on an empty stomach. Then number two, you do not take antacid medicine if you are taking iron pills. This is not a very good combination. Number 3 is to take iron pills with vitamin C, because as I said before, it helps with absorbing iron in the body. And I'm pretty sure I hope it helps you in the future. As we end our lesson, the body is like a piano and happiness is like music. It is needful to have the instrument in good order by Henry Ward Beckman. So in order to have a good body, you have to take care of it. Correct?
Yes.
Yes. Then for a Bible verse, a joyful heart is good medicine, but a crushed spirit dries up the bones. From Proverbs 17:22. So we need to be happy as well to be healthy, not just physically. So thank you. I hope you have learned a lot through our discussion.
Thank you, ma'am.
Thank you for accepting to be my patient.
I needed all the information.
Thank you.